The heat of late summer in Guangdong province has always been a given. A thick, humid blanket settles over the megacities, Guangzhou, Shenzhen. But in August of 2025 something else arrived with the heat, something invisible and insidious. It began quietly, a ripple of distress in local clinics. Patients arrived with a sudden high fever, their bodies ached, pain so intense they said it felt like bones were breaking. Their joints swelled, making simple movements excruciating. This was not the familiar flu, this was something different, something more vicious. At first, a handful of cases, then dozens, then hundreds. Numbers climbed with breathtaking speed, overwhelming ERs. The signature symptom, debilitating joint pain, left people contorted and bedridden. In urban villages, crowded homes helped the virus spread like wildfire. The air grew quiet where commerce once buzzed, replaced by ambulance sirens and anxious families. The outbreak struck with brutal efficiency. Could this fever from southern China spread its tendrils across the globe and become the next great public health catastrophe? So, what exactly is this virus causing so much suffering? The name Chikungunya comes from the Kimakonde language of southeastern Tanzania. It means to become contorted. This is a chillingly accurate description of the severe joint pain that forces patients into stooped, bent-over postures. While it may be new to many, chikungunya is not a new virus. It was first identified in Tanzania back in 1952. The virus itself is transmitted to humans by the bite of infected mosquitoes, Aedes aegypti, Aedes albopictus. These are the same aggressive, day-biting mosquitoes responsible for spreading dengue, Zika, and yellow fever. They thrive in urban environments, breeding in small pools of standing water, flower pots, discarded tires, clogged gutters. Once a mosquito bites an infected person, it can then transmit the virus to others with its next bite, creating a rapid chain of transmission. The symptoms of chikungunya are unmistakable and severe. They typically begin 3 to 7 days after being bitten by an infected mosquito. The onset is abrupt, a high fever often accompanied by a headache, muscle pain, nausea, and fatigue. A characteristic skin rash is also very common. But the defining feature, the one that gives the disease its name, is the debilitating pain in the joints. This arthralgia can be so intense that it incapacitates a person for days or even weeks. And for some, the pain doesn't go away. A significant percentage of patients develop chronic joint pain that can persist for months, or even years. In southern China, mosquito-borne illnesses are common, and telling them apart can stump even doctors. Clinicians often face confusing charts and overlapping symptoms in clinics. Chikungunya, dengue, and Zika, close cousins with overlapping symptoms. The same Aedes mosquitoes spread all three viruses, thriving side by side. All three often start with fever, headache, rash, and muscle pain. But chikungunya's hallmark is intense joint pain that clinicians recognize. Arthralgia causes swollen, inflamed joints, the source of the name chikungunya. Patients can be bedridden for days or even weeks from severe joint pain. In contrast, dengue can progress to dengue hemorrhagic fever and life-threatening bleeding. Zika is usually milder but poses severe risk of microcephaly in infants. Newborns and the elderly face higher risks from these infections. There is currently no specific antiviral for chikungunya. Research continues. Treatment focuses on rest, hydration, and pain relief like NSAIDs. Prevention, mosquito control, and removing standing water remains our best defense. During the Guangdong outbreak, PCR labs raced to identify chikungunya at scale. At first, many cases were misidentified as an aggressive form of dengue. Multiplex diagnostic machines now help labs quickly differentiate these viral cousins. Guangdong province did not become the epicenter of this outbreak by chance. A combination of environmental factors, rapid urbanization, and recent weather events created a perfect breeding ground. Southern China has a humid subtropical climate which provides the warm, wet conditions that mosquitoes need to thrive. A damp heat settled over the streets, extending mosquito activity into the night. At dusk, mosquitoes swarmed near water, silhouettes filling the twilight. The summer of 2025 was marked by unusually heavy monsoon rains leading to widespread flooding across the Pearl River Delta. These floods left behind countless pools of stagnant water, large ponds in inundated parks, small puddles in urban construction sites. Each one became a potential mosquito nursery. Layered on top of this was one of the most densely populated and rapidly urbanized regions on the planet. Guangzhou, Shenzhen, Dongguan, Towering high-rises and crowded neighborhoods packed millions together. Cramped alleyways and courtyard housing created dense living quarters. Factories and warehouses sprawled across the outskirts linked by shipping routes. This density gives mosquitoes an endless supply of human blood meals, allowing a virus to move from person to person with terrifying speed. The vector Aedes albopictus, the Asian tiger mosquito, is particularly well adapted to these conditions. It's a hardy, aggressive biter that has expanded globally by hitching rides in shipments, especially used tires. Unlike many mosquitoes that prefer natural habitats, the Asian tiger mosquito thrives in man-made environments. It can breed in incredibly small amounts of water, a bottle cap, a flower pot saucer, a discarded food container. The first whispers of the outbreak emerged in mid-August 2025. A cluster of patients with high fever and severe joint pain was reported in a densely populated district of Foshan. Initially diagnosed as severe influenza or dengue, the cases were notable for their intensity. By the last week of August, local hospitals were seeing dozens of similar cases daily. Public health officials sent samples for advanced virological analysis. On August 28, the China CDC confirmed the culprit, Chikungunya virus. At that point, an estimated 500 cases had already been identified in Foshan and western districts of Guangdong. The virus spread with alarming velocity, following the major transportation arteries. It jumped from Foshan to the heart of Guangzhou, a metropolis of over 18 million people. The outbreak then radiated outwards, appearing in the manufacturing hub of Dongguan, and it reached the tech powerhouse of Shenzhen. The virus was moving as fast as the high-speed trains that connect the region. By mid-September, just 3 weeks after initial confirmation, the official case count for Guangdong had surpassed 50,000. The numbers told a story of exponential growth. By the end of September, the official tally had climbed to over 200,000 confirmed cases in Guangdong alone. Temporary clinics were set up in stadiums and exhibition centers to handle overflow patients. At its height, Guangdong was reporting over 15,000 new cases per day. Faced with an escalating crisis, Beijing's response was swift, massive, and uncompromising. Officials rushed through corridors as emergency vehicles mobilized and rapid response teams assembled. Large coordinated teams formed convoys of government vehicles to reach affected provinces. The central government declared a Level 2 public health emergency in Guangdong, triggering a top-down mobilization. The enemy wasn't just the virus, it was the mosquito that carried it. Fleets of drones were dispatched to survey urban areas for breeding sites. Aerial inspections revealed water-filled containers and construction sites harboring larvae. Large crop sprayer drones released mist, spraying insecticide across dense urban blocks. Thousands of public health workers and volunteers went door to door inspecting homes. Fogging trucks rolled through streets at dawn and dusk, blanketing neighborhoods in insecticide. Behind the scenes, laboratories scaled up innovative biological controls. Technicians tended rows of mosquito-rearing trays in insect-rearing factories. Male Aedes mosquitoes infected with Wolbachia were prepared to reduce population fertility. Workers released lab-grown males into the wild, where their eggs failed to hatch. Millions of sterile mosquitoes were released weekly, aiming to crash local populations. Strict enforcement followed. Notices, patrols, fines, and neighborhood committees ensured compliance. As the case numbers in Guangdong skyrocketed, the world watched with growing anxiety. Global newsrooms and anxious crowds tuned in, watching developments on multiple screens. The memory of past pandemics and the speed at which they can cross oceans was fresh in the minds of global health leaders. The World Health Organization declared the Chikungunya outbreak a public health event of international concern. The WHO worked closely with Chinese authorities, offering technical assistance and urging transparency in data sharing. The key concern was the potential for the virus to seed itself in new regions via international travel. The United States Centers for Disease Control and Prevention raised their travel health notice for southern China to Level 2, practice enhanced precautions. The European Center for Disease Prevention and Control issued similar warnings. They advised travelers to take strict measures to prevent mosquito bites, warning pregnant women and immunocompromised individuals to consider postponing travel. These advisories had an immediate chilling effect on international travel and business. The first imported cases began to appear globally by mid-September, with travelers returning home. A tourist flying home to Australia added to the tally of imported cases. A student arriving in Vancouver was identified as another imported case. Each case triggered a localized public health response: contact tracing, patient isolation, and enhanced mosquito surveillance. Countries in Southeast Asia like Thailand and Malaysia, where the Aedes mosquito is already endemic, were on high alert. They feared that numerous infected travelers could ignite large-scale local outbreaks. The Guangdong outbreak was no longer just China's problem. International experts voiced concerns in stark terms, noting Aedes albopictus has established itself in southern Europe and the Americas. Behind the staggering statistics are the individual stories of human suffering and resilience. Li Wei remembers the fever hitting him like a physical blow one afternoon on the assembly line. Within hours he was unable to stand.
It felt like my bones were on fire. Every joint, from my fingers to my ankles, was screaming in pain. I have worked hard my whole life, but this pain brought me to my knees.
I worried about my family, about my job. How can you provide for anyone when you cannot even hold a pair of chopsticks? Jiang Mei had to become the sole caregiver for her parents, both of whom were struck down by chikungunya. Her father's pain was so severe he couldn't get out of bed for 2 weeks.
I had to do everything.
Dr. Chen Jing worked 16-hour shifts for weeks on end.
We were completely overwhelmed.
It wasn't just the number of patients, it was their level of distress.
We saw grown men crying from the pain. We held the hands of elderly patients who were confused and frightened.
We had to be doctors, nurses, and counselors all at once, all while trying to protect ourselves and our own families from infection. As China's aggressive control measures begin to bend the curve of the outbreak, the focus is now shifting to the future. A critical part of that future is the development of a vaccine. While several chikungunya vaccine candidates have been in development for years, the 2025 Guangdong crisis has infused a new sense of urgency. In August 2023, the world saw the first chikungunya vaccine approved for use in adults. The Guangdong outbreak has put immense pressure on manufacturers to scale up production and on regulators to expedite approvals. The crisis has cast a harsh spotlight on the profound impact of climate change on global health. Scientists have been warning for years that a warming planet would expand the geographic range of mosquito vectors: Aedes aegypti, Aedes albopictus. Rising temperatures and more frequent extreme weather events create ideal conditions for these mosquitoes to breed, and for the viruses they carry to replicate more quickly. The most immediate lessons are for public health preparedness. The Guangdong outbreak demonstrated the critical need for robust surveillance systems that can rapidly detect unusual disease clusters. It showed the importance of having pre-existing plans for scaling up diagnostic testing, managing healthcare surges, and implementing effective vector control. The initial confusion between dengue and chikungunya cost valuable time, highlighting the need for better point-of-care diagnostics and more integrated public health strategies that can tackle multiple mosquito-borne threats simultaneously. Ultimately, the 2025 chikungunya outbreak serves as a powerful call to action. It is a reminder that the fight against infectious diseases requires a global, unified effort. This means strengthening public health infrastructure everywhere, investing in research and development, and addressing the root causes of outbreaks like climate change and unplanned urbanization. The lessons we learn from the fever that gripped Guangdong will determine how ready we are for the next one. Let this be a wake-up call for us all.